purpose of this video is to help you understand some of the different types of qualitative research design. Why is this so important? When we read a research article with a critical eye, we judge it according to criteria that relates to the type of design that was used. The criteria varies according to design, so an important first step is identifying the type of qualitative research design that was used in a study. The overall purpose of qualitative research is to uncover in-depth knowledge that comes from a study of participants' perceptions of the world. Researchers therefore tend to work closely with small numbers of participants. They don't collect information that's analyzed numerically. Instead, they collect participants' perceptions of the world through their words, using interviews and through other methods such as observation, stories, diaries, drawings, and so on. Whereas quantitative researchers conduct their studies so the results can be generalized or widely applied to large groups, qualitative researchers simply aim to capture as accurately as possible the study participants' thoughts. This is very important to remember. Results from these studies are not generalized. Under the large qualitative umbrella come many types of research. In this course, we focus on 4 of the most common types that we see in the nursing literature: phenomenology, grounded theory, action or participatory research, and ethnography. Why are there so many different types? Because each approach answers a certain type of research question best. I'll discuss the 4 types briefly. However, it'll be your job to familiarize yourself with the sampling methods, data collection, and analysis methods of each type. This is important because each method has its own practices. Let's start with phenomenology. This branch of qualitative research comes from the discipline of philosophy. Essentially, these researchers who practice phenomenology believe that there's a tremendous amount that can be learned by asking people to describe important experiences that have been part of their daily lives. They aim to understand people's lived experiences, especially during critical life events such as being diagnosed with an illness, experiencing a loss, giving birth, or dying. Typical research questions in a phenomenological study might be, what's it like to be diagnosed with multiple sclerosis? What is the experience of mothers and fathers who have a child in the neonatal ICU? Phenomenological researchers collect data from very small numbers of people through interviews that typically last at least 1 hour. Data analysis takes place in a variety of ways, but generally the end result is a report that pulls together themes or patterns of recurring messages heard by the researcher. Why do nurses read these kinds of studies? Because they give us an understanding of an illness or event that we have not likely experienced. Now this helps us to appreciate what our patients are living with and makes us better able to help them. Let's now discuss grounded theory design. This branch of qualitative research has its roots in sociology. The purpose of this type of method is to describe the stages of a basic social process over time. A sample research question for a grounded theory study would be, what's it like for families to adapt to having a child with cancer? What is it like to be diagnosed with diabetes and come to live with that health problem over a lifetime? Data are collected from individuals and at times from their families, usually through interviews, but also through observation of people in their homes or the hospital, through field notes, chart reviews, and diaries. And at the end of these studies, the reader should expect to see a newly developed theory or a contribution to an existing theory. The researchers build a theory that is grounded or based on the data that were collected. That's how it gets its name. Why do nurses read these studies? We learn about complex adaptation processes our patients develop when they face health problems, and this helps us to mobilize the resources that our patients will need over time. Our next topic is action or participatory action research. This method is allied closely to critical social theory and feminism, and it's gaining momentum in healthcare. Rather than the researcher deciding what needs to be studied, the researcher often gets the idea for the study by working closely with people who have a problem that they want addressed. The goal is not to simply collect data for the sake of adding to our knowledge base. It's to bring about action that will benefit the participants by fostering their skill development or bringing about a change in the way that they access or receive health care. Typical research questions might include, what are the most effective practices at a university health clinic that will encourage the students to use the clinic? Another study might be, what is the role of a community clinic in encouraging low-income pregnant women to come for regular prenatal checkups? The participants might give input to the actual research design. They might actually participate in data collection and analysis. They will certainly give input to the intervention that's going to be introduced and what is done with the study results. These studies typically produce reports and workshops where the participants share the results with community leaders so that their needs will be addressed. How are these studies useful to us in nursing? We learn about innovative health interventions that have been initiated and evaluated in real-life settings. Our last topic is ethnography. This method has its roots in anthropology. These researchers are interested in studying individuals and groups in the context of their cultural environment. In this case, culture means more than ethnic practices. It can refer to the broader community. Some examples of topics that these researchers might explore would be the smoking behaviors of people who attend outpatient mental health clinics, the health-seeking behaviors regarding pap tests for women who have recently come to Canada from East India, or the nutritional practices of grade 2 children who live in a low-income neighborhood. Data are collected, often over a long period of time in the field, using observation, interviews with key participants, field notes, video recordings, and diaries. What do nurses learn by reading these studies? We get a deeper understanding of the cultural forces and interplay between individuals and their culture, and that helps us understand individual and group health behaviors so that we can work with these people to meet their needs. So to summarize then, there have been many types of qualitative research discussed here. Each provides understanding and answers to different types of questions that nurses have regarding their practice. It's important to familiarize yourself with the purpose, data collection and analysis processes with the 4 types we've discussed here today. Thank you.